All right, well, we'll go ahead and get started. Hi, everyone, and welcome. We're so glad you could join us today for our second installment of our Patient Program and Supportive Resources webinar series. My name is Amy Marbaugh, and I am the Senior Director of Patient Programs here at the KCA. I'm joined by my colleague, Sarah, who's the Senior Manager of Patient Programs. Today, we'll be highlighting several supportive programs designed to help patients and caregivers navigate kidney cancer, no matter where they are in their journey. We'll introduce you to partners of the KCA, patient ambassadors, and other team members of the KCA who lead programs, and you'll hear more about each of how each resource works. We'll wrap it up with time for any questions you may have, so be sure to continue to add those in the Q&A box at the bottom of your screen throughout the webinar. Let's go ahead and get started. Sarah, I'll toss it over to you.
Thanks, Amy. So first, we're going to talk about a program that connects people directly. We're joined by Jackie Harrigot, Director of Partnerships and Engagement at Immerman Angels. Jackie is going to share more about Immerman Angels and their peer mentor program. All right, Jackie, take it away.
Thanks so much. Appreciate that. Let me get my slides. Here we go. So, hi, everybody. As you heard, my name is Jackie Harrigot. I am the Director of Partnerships and Engagement at Immerman Angels. And why do I get this honor of speaking to all you wonderful people today? Well, before I knew about Immerman Angels, I knew cancer, and I knew it deeply, personally. I had lost many family members to cancer. Just to name a few, my grandmother, my aunt, and closest to me, my mom. So a long time, before knowing about Immerman, cancer meant two things to me. It meant a diagnosis and then a loss. That was my reality, and that was the pain that I carried. And I knew that I had to do something with the experiences that I had gone through with cancer, but I didn't know what it was. I knew that I didn't have the brain to discover a cure for cancer. I knew that I didn't have the financial means to fund the research, but I had something else. I had the empathy and the experience to build connections. And so when I found out about Immerman Angels in 2012, I actually found out by finding someone who had also lost their mom to lung cancer. This woman was right around my age when this experience happened, and she started talking about her experience with cancer. And it was odd because her story was if she was telling me mine. Her experience was so parallel. I couldn't believe it, and so something in me shifted. And it was like as if an invisible wall came crumbling down to the ground. And I didn't even know this wall existed until this very moment. And I just realized that I had never felt so seen and so deeply understood of my past. And that experience changed me. And it made me realize something really vital. We need to find one another. We need to feel empowered. And when we connect and find one another, we do heal. And I needed a way to turn my pain into power. And Immerman Angels allowed me to do just that. You see, I became a mentor angel. Well, Immerman Angels is a global free nonprofit that provides comfort and understanding for all cancer fighters, survivors, previvors, and caregivers on a one-on-one connection to someone who's been there. Now, it all started from a personal experience and turned into this revolution from Johnny Immerman, who started the organization because he himself went through testicular cancer at age 26. He went through cancer, though, with tons of friends and family all around him telling him he was going to be okay. But what he didn't have was someone to talk to him about how the chemo felt like when it hit his veins. Someone to inspire him about the fact that he could get back into the gym after cancer. Someone to show him that people would date somebody after cancer. So Johnny envisioned a world where cancer is not a solitary experience because it doesn't need to be, and created this program where there are people called mentor angels. Like I said, these people, they throw that life raft back. They go through these experiences and they share tips and tricks. They're like cancer confidants because they truly understand what it's like because they've been there, done that. And more than just tips, mentor angels offer something even more important. It's that presence, that connection to someone who truly understands all of you. Now, let's face it, cancer is definitely, if nothing else, a great unifier. It doesn't check credentials, it doesn't ask for permission, it just shows up uninvited. And when it does, it changes everything. And while cancer takes a lot, it reveals some things too, especially when you become a mentor angel, that volunteer that gives back. It shows you that now you have a new appreciation for time, the importance of showing up for one another. And it's a club that we realize nobody wants to join, but once you're in it, you realize how deeply human and connected we all are. Watching someone else walk a path that you've already walked and being a part of their growth, their healing, or even just their daily survival, it reminds you of just how far you've come, what you've endured, and how much you truly have to offer. Listen, I know everybody carries scars of what they've gone through. But guess what? It's okay that you have those scars because it can be a roadmap for someone else's survival. When you become a mentor, you become the person that you once needed. That's powerful. That could be a legacy. You show someone that there's life after this experience. There's hope. Do you want to have control over something? I bet you do. So here's how. You can take your narrative and instead of being defined at what's happened to you, by becoming a mentor angel, you can define what happens through you. Because your story can help someone else survive, hope, and feel less alone. And one of the things about our program is that we meet people where you're at. So if you've been wondering, what do I do with all this experience now that I've gone through it? Well, you can become a mentor angel or seek support and get a mentor angel yourself without ever even leaving your home. Because the way our program works is you can talk via video, phone, texting, email, however works for you, right? We see, the way people need to meet with others is different. So we try to meet you where you're at. Because all you need to do is register with us and you can talk to someone maybe once or twice. You might have one or two questions. Some people decide they want to talk through their treatment, and others, they become best friends. In fact, one of my mentees I've been connected to for over 12 years, and it's been a really amazing experience. Now, something more you should know is it's not just me talking about how important one-on-one support is. There's actually studies out there, and one of them that I wanted to highlight was done in 2024, and it was done by the National Comprehensive Cancer Network. So what they did was they showed that in the US, among cancer survivors, those that have actually said they have a higher rate of loneliness that they feel, they actually determined they also have a higher risk of death. That's crazy. Let it sit in. Like, just think about that. People that are lonely have an actual rate of 67% higher mortality risk. So the research is clear. Chronic loneliness can have a serious impact on mental and physical health and well being. So, this is not just a feeling, it's a warning sign. It isn't just about emotions, it's about survival. Another study was done and it showed that people who have peer support reported a 40% higher treatment adherence. And they said that they had a overall better mental health and greater satisfaction with their care treatment. So you can see connection is a lifeline. And that's why I'm here to tell you about this lifeline, a solution, and it's free. And it's Immerman Angels. 89% of the people that use our service, when surveyed, they agree that they do feel less isolated and alone, so that loneliness can dissipate. So if you're sitting here thinking nobody understands what I'm going through, it's not true. We have people waiting for you. So let's talk about what this organization looks like in a deeper level. We've been doing this for over 19 years, this peer-to-peer, one-on-one matching. And at this point, we're in 123 countries. And we're connecting for over 146 cancer types and all the genetic mutations that put you at a higher risk for cancer. And at this point, we have matched over 46,000 people looking for support. But we're not doing this alone because we have partners like hospitals and other partner organizations like KCA. So thank you for having me and being one of our tremendous partners. Now, we do have the world's largest peer-to-peer cancer support, and I'll show you once you're interested. And I know you all are wondering, how in the world do you get started with us today? So because KCA believes so much in this power of mentorship, they've actually put a link on their website. And so I put it here for you. And also the QR code. So if it's easier, you can hover your phone over that QR code and get started with us today. Because we understand the power of mentorship and not feeling alone. Thank you.
Thank you, Jackie. That was such a great overview of Immerman Angels and peer mentoring and the need for peer mentoring. And so we're just really appreciative for you to join us today, as well as to be such a great partner to KCA. So excited to continue that partnership into 2026. All right, we are going to move now to talk about KCA's Facebook community. We have Sid Sadler with us today. He is a kidney cancer patient and a member of KCA's Patient and Caregiver Advisory Council. He serves as a patient moderator on KCA's Facebook community. So, Sid, I'll let you take it from here.
All right, thank you, Amy, so much. Let me get my screen shared. Let's get this going. First and foremost, want to thank the KCA for having me speak today. I really loved Jackie's presentation before mine. It was awesome. I'm very familiar with Immerman's Angels and all the great work that they do. As Amy said, my name is Sid Sadler. I am a patient advocate and I also work in communications and marketing. And today I want to talk to you a little bit about the Facebook group that the KCA has. Before doing that, I kind of wanted to give some perspective about who I am as a person. So I was diagnosed almost 2 years ago, actually, in the month of December in 2023, with a 10.5 centimeter tumor on my left kidney. My official diagnosis was stage 2 clear cell renal carcinoma. And I did have surgery, a radical nephrectomy to remove my left kidney and tumor. And I'm currently on active surveillance on scans every 6 months. And with all that being said, with that perspective that I kind of just gave you a Cliff Notes version of my story, a lot of patients find themselves, where do they go from here? Where do they go after surgery? Typically prior to a diagnosis or during a diagnosis, I should say, it's a very stressful time, that month to month and a half, 2 months of maybe waiting for surgery or waiting for treatment or waiting for decisions to be made. A lot of times, that time is spent on Google. That time is spent kind of doing all the things that your doctor probably says you shouldn't do. But I'm here to tell you that there is a great resource when you found yourself in the shoes of being diagnosed, or you have a loved one that's being diagnosed and you're their caregiver. So right after I found out that I had, or I likely had kidney cancer, I found the KCA's support group online. Their Facebook group is, I want to say a little bit over, it says 7,000 members right there, but I think we're a little over 7,000 members right now. And you can read the kind of the little version right here. But basically what I'm here to say is this group has been extremely useful for me, as I still consider myself a kind of a newly diagnosed patient compared to some other patients, possibly. And it's a supportive group, but you're also going to find a lot of educational materials on there. I think one of the biggest things that a lot of patients run into, regardless of diagnosis or situations, is they go on Google, they find this kind of unvetted information or backwards looking statistics and all these things. And, I'm not a doctor. I'm not here to really go into the weeds with those numbers. But what I am here to say is, the KCA has a strong presence in the kidney cancer space, and they are connected with extremely bright doctors that are running trials, and doctors that are on their medical steering committee, etc. And this group is meant for support for the patient or caregiver after they have been diagnosed. I can't tell you the amount of patients that I have met now, actually, some of them in person, based off of this community as a whole. One of the other important points that I want to make, and I'll kind of skip to the next slide. I've kind of pointed out some of these points already, but it is private and it is moderated. So if you're not familiar with that, basically being private, it means that if you are worried about maybe possibly advertising your diagnosis or having that out and about, the group is private, so nobody can see that you are in or when you post in that group. It's also moderated. So it's not just unfettered internet access where people can just post whatever. It is very much moderated, and the ebbs and flow of information that come onto the group are vetted, right? We don't want something that's just completely out of left field on the group, especially focusing on those newly diagnosed patients. They're looking for a place of discussion, support, and community, especially right after they're diagnosed, and also as they're going through treatment or as they have anxiety for an upcoming scan or what have you. Both caregivers and patients are welcome, so it's not just patients, it's not just caregivers, and there are great discussions in both of those avenues. Some patients and some caregivers, and some both. I'm sure we have patients and caregivers that are both on there that know each other, or it could be just a caregiver or just a patient. Uh, the topics are wide. There's a wide variety of topics that are discussed. Just to kind of name a few that are, I don't want to say like popular, but the things we see the most of are maybe what to expect going into a surgery, whether it's a partial or radical nephrectomy, kind of what to expect and how the recovery is. Those are typically some of the most consistent topics we see. And it is very common to be nervous prior to a surgery or right before a surgery. So kind of getting that information, and not everybody's situation is going to be the same, but there are some constants that happen for people during and post surgery that patients and caregivers are able to provide that important perspective. I like to also make the point that, 20 years ago, 15, 20, 25 years ago, this was not a thing, right? Most support groups were in person. They might be once a week or once every other week. And it was kind of not to say that those were not effective or they did not help people. They did. But this support group gives you an easier avenue to connect with patients and caregivers that are going through exactly what you are going through. And that was very beneficial for me. Not only because I have a social media, marketing background, I was already used to it, but even if, let's say, you've never been on social media before, maybe you just have a Facebook page, but you don't even really go on there. It's as easy as going and finding this group on Facebook and joining. I believe there are a couple of questions that they ask. I would have to be reminded. But once you're in, you're in. And like I said, it's completely private. So you don't have to worry about having that on Facebook or right in front of people. You are not able to, people are not able to see that you are in the group. So you can post freely and ask some of those questions that maybe some patients are a little embarrassed to ask, or afraid to ask. And The kind of one of the last points that I'll make is, that first week, 2 weeks, 3 weeks that you're diagnosed, you are hit with a lot of information. You're sometimes hit with a lot of opinions of people that maybe haven't been diagnosed with cancer, maybe they have been diagnosed with cancer or kidney cancer. And it's a very stressful time to where you're really trying to peel back things and figure out exactly what you need to do. And I know that this group was one of the tools that I utilized during my diagnosis. I posted quite frequently the first week or 2 or 3 weeks prior to my surgery, and post surgery, helping other patients. So it's a way to not only get help and kind of even out the playing field while you're being diagnosed, but it's also a way for you to help other patients that are going through the situation that you had previously went through. I think the last one is just our information there. You can see how to find us on Facebook, Instagram, and LinkedIn and X as well. And I appreciate it, guys. Thank you so much for having me.
All right, thank you so much, Sid. As you wonderfully showed, that online connection can be such a lifeline. So we appreciate you taking the time to share that today. Just a reminder also to the audience, please feel free to drop your questions in the chat. We'll be able to answer them at the end of the presentations. So moving on next, we have a podcast dedicated to education and personal stories. We're welcomed by Anna Maria Scaccia, a kidney cancer patient and also a member of KCA's Patient and Caregiver Advisory Council. She also, and like I said, she serves as the moderator for our podcast. So welcome, Anna Maria. Take it away.
Thank you for having me. Let's share my screen because I do have a couple of slides. Let's do that and then put it back and put it into presentation mode. I'm assuming everyone can see it. So, as Sarah mentioned, I host the Kidney Cancer Unfiltered podcast, which comes out twice a year. It is a collection of raw, intimate conversations between individuals touched by cancer as well as expert insights. I myself, many of you probably know who I am. But in case you don't, I myself am a kidney cancer survivor as well as a thyroid cancer survivor and a patient advocate. I also have a background in journalism and communications. So podcasting is just kind of a natural progression to what I do in my day job and what I do as a social justice advocate and health advocate. Here's just a couple of stats. And this is probably going to be a lot quicker than other people's presentations. So Sarah, Amy, feel free to just throw me into a Q&A. But we have 4 seasons out now. We're working on our fifth. We started this podcast, much like the Facebook group, much like Immerman Angels. We started this podcast as another vehicle to connect survivors and their families to other survivors and their families, as well as experts in the field who could answer those questions, could help with any fears and concerns, could provide resources. These are just some of our episodes that we've had in the past, a couple from the first season, a couple from the second. One thing as an advocate that I hear often about is diet and nutrition. It's about having cancer at a young age. I myself was diagnosed with kidney cancer at 37 and thyroid cancer when I just turned 40. Also, ways to deal with anxiety and deal with all the grief and fears and everything else that comes with a cancer diagnosis. And so a lot of those conversations that I have, a lot of the conversations we hear at the KCA, they really influence the type of topics that we cover. And it looks like my video may be freezing up, so I apologize if that is the case. Hopefully you all can hear me. Hopefully you all can hear me pretty well. Nonetheless, sorry. Apparently, I am having technical difficulties with everything. That is kind of my life. You should hear the raw cuts of the actual podcast. There's a lot of editing that goes on to make it sound good. But the podcast itself is accessed around the world. We've reached 38 countries. We've had over 4,300 downloads. We've had over 3,100 listeners. You could listen to it anywhere you get your favorite podcast. You just scan that QR code to find find yours. Some places, I listen to mine on Apple Podcasts. I know some people listen to Spotify. We host it on Acast. So a couple of things that are coming up for the fifth season, which we're in the process of recording now. We're going to be discussing romance, intimacy, and sexual wellness. We're also going to look at, patients dealing with uncertainty. We're going to have some of our PACA members join us for that. Caregiving. We're going to look at turning grief into action with another one of our ambassadors and partners. We will also look at this year. Shoot, I am losing my train of thought when it comes to the topics, but those are just some of the pieces and some of the topics that we will be looking at. And yeah, I think that's essentially it. Again, the podcast was started as a way to get people connected to each other and to resources to make them feel that they're not alone. And it's just another vehicle for that, right? Facebook groups, peer mentorship, those are kind of like intimate and one-on-one. This is something that's a bit more broadly applicable, and we try to represent a lot of different communities and a lot of different demographics in this as well. So, last year we looked at the Native population and kidney cancer. We've also looked at what it means to get treatment in rural communities. So we try to make this as inclusive of the kidney cancer experience as possible. So yeah, that is all I have. So I'm just going to stop sharing now, and not sure if you want to take me through a Q&A or just give this time to other people.
Yeah, we'll have some questions at the end, but that was a great overview. I feel like podcasts are universal, and we highlighted that with all of the countries that we have reach into. So very excited to continue our podcast into
Yeah.
2026.
Yeah, I'm very excited. Well, thank you. I will get off mute and
All right, perfect. We are going to move on to KCA's Patient Navigator Program and our Financial Assistance Program. We hear all the time from patients, several different questions, different needs that patients have. And so we created these two very unique programs, our Navigator Program and our Financial Assistance Program. And they are overseen by our patient liaison, Rosemary, who is joining us today. So I'm going to turn it over to Rosemary, and she's going to share all about these programs and how you can receive assistance from us. Thanks, Rosemary.
Hi, thank you, Amy. Can you all hear me okay?
Good.
All right, thanks for the thumbs up. Appreciate that. Hi, everyone. I'm Rosemary. I'm KCA's patient liaison, as Amy mentioned. And today I would like to share some information on our Patient Navigator and Financial Assistance programs. So let's start with our Patient Navigator program. So anyone in our kidney cancer community can reach out with questions. Look, if you're looking for resources, we're here to help and help support. So some areas that we help with, if you're looking for any type of information on kidney cancer, so whether it's symptoms, diagnosing, treatment, maybe side effects, maybe looking for a new physician, kidney cancer specialist. Perhaps someone is looking for information on support groups or one-to-one connection with another patient and or caregiver. We also help caregivers with resources. Maybe an individual needs some information on professional therapy and counselors. We can help with that. Also, we're more than happy to research other resources provided by other organizations. So like financial help, so like rent, mortgage, utility, maybe it's medical bills. Just anything that somebody needs help with, we're happy to research and find some information on it. Now, we do have some limitations on the program, mainly two. One, we cannot do medical advice. So, if it's, reading individual scans, medical records, or giving advice about a personal care or the diagnosis, treatment plan, I'm not able to do that. And the other thing we do not do is case management services. So setting up physician appointments or filling out paperwork. Maybe it's for Medicaid, Medicare, maybe it's financial forms. Those would be limitations of the program. And the way to connect with this program would be, we do on our website, and I have the directory there. So if you go to kidneycancer.org, hit the drop-down menu for patients and caregivers, select support and one-on-one form. You can submit your request that way, or you can call me directly at 800-544-3522, or even email me at patients@kidneycancer.org, and we're happy to help. Okay, so our financial assistance program is a $250 Visa gift card for approved applications for kidney cancer related expenses for patients. And our eligibility requirements for this program are applicants must be a U.S. citizen or legal resident. The diagnosis, the kidney cancer diagnosis, must be confirmed by the provider. We have listed on the screen the kidney cancer types that are accepted in the program. Must show proof of financial hardship. And then just examples of what kidney cancer related expenses are. So, the financial needs could be medical related costs, so like co-pays, insurance premiums, medical bills, which I mentioned earlier, prescriptions, kidney cancer related travel, so gasoline, maybe it's lodging. There can be medical equipment associated, funeral burial expenses, and recently we added mental health and then also respite care services. Now, how to apply for this program. So a member of the kidney cancer medical team would apply on behalf of the patient using our online form. The process takes about 7 to 10 business days from start to finish. And patients are eligible to receive the $250 Visa card once every 12 months. Just a footnote, this program is not open year round. It's open, it has windows of opening like 2 to 3 times per year. So I thought that would be important to mention. Okay, and my contact information, again, it's 800-544-3522, or I can be reached at patients@kidneycancer.org, and look forward to connecting with you. And thank you for being with us today.
Thank you so much, Rosemary. We all know that having knowledgeable one-on-one help is very meaningful. So we appreciate the work that you do at the KCA. All right, so finally, we're going to talk about connection live in real time. So we're going to be chatting about our virtual support groups at the KCA. We are joined by Peggy Zuckerman, who moderates KCA's Patient Perspectives support group, and Salima Witt, who moderates KCA's Caregiver Connections support group. They're both kidney cancer patients and members of KCA's Patient and Caregiver Advisory Council. Welcome both to the webinar.
Thank you so much for having us.
Of
Thank you.
course.
You can see I probably am the most challenged here technically, but I am more considered an expert on kidney cancer research and a little extra TLC along the way.
That's okay.
We can hear you, and I think that's the most important thing right now is for the audience to just be able to hear you. And Peggy, I'm actually going to go into the first question, and our first question is, how often does Patient Perspectives meet and who can join?
First of all, most importantly, everybody can join. And we have typically met once a month. Of course, December gets to be crazy, so we've missed one. But we will be meeting once a month henceforth. We have our next meeting on of this month. We sort of missed November on the 10th. So basically next week. And anybody can join. I happily let Rosemary send out notices and she'll get your information and sign you up with a link. I would say the most important thing about that is to know there's somebody out there and a group of people who are suddenly your friends online. And if you're like me with a little challenge technically, we can accommodate you as well. And we can always keep learning that message to me. Thank you.
All right, perfect.
Salima, I'll ask you the same question about caregiver connections. Who is the intended audience for that support group, and when do you guys meet?
Yeah, so this whole time, my dogs have not been barking, and now they are, of course. So anyway, thanks for having me. So we meet the last Tuesday of every month. So 4 p.m. Pacific, 7 p.m. Eastern, and anybody can join. We have patients, we have caregivers, we have everyone. So anyone who needs support is welcome to join, kidney cancer related.
Great. All right, Peggy, what can participants expect during patient perspectives? Do you mind just sharing what the rundown is? Do people have to come prepared with any questions? Can they just listen in? Do they have to talk? Things of that sort.
Well, we have a mix of all of that. We have people who describe themselves as lurkers. They just wanted to see who this community of, as I think we've said, the community you never want to join. So they can come in and find out, number one, there is somebody else out there who has the same kind of cancer that they have. We welcome all cancer types. I try to teach people over the years that it's not just kidney cancer as if that were one thing, but I think the latest count is 16 with variations along the way. Anyone with those types and anybody who might feel that they have a chance of being diagnosed, perhaps they've had a scan, showed a mass or some such in their kidney and have difficult time even getting the basics about what do you do next, can come on in. And I always think the way to be in control is, I think both all of us are going to allude to have education about what they have just been diagnosed or being diagnosed. Diagnosis is a process for the most part. And when you have a rare disease like kidney cancers and the variations, you are desperate for good, credible information. Frankly, there, especially for the people who are in the rural areas, and I grew up in the tiniest town you can imagine, you need information that's credible to know that your resources can be, and your doctors can be aided by providing the information that the KCA will have. All those things add to strengthening that patient's control over the disease, understand what he's facing, and perhaps most important, learning how to level the playing field about the information that is relevant to their case. I can go on more about that, but just as a perspective, when I write people, for example, I am certain to explain that I had metastatic disease, a pretty damning situation as to my lifespan, but that was 21 years ago. And I was horrified to know I was sick and horrified how difficult it was to get good information in patient-friendly terms. So that I didn't even know what type of kidney cancer I had. I knew only that I had a huge tumor, metastases in my lungs, and I was a goner. And lots of tears and terror. And now it's 21 years later with a tremendous improvement in treatments of all types, medications, radiation, ablation, surgical, and then of course the mix of medications that might prepare you for an easier surgery or say that you must take a medicine more like this versus that. All that is quite new. And frankly, the less experienced doctor and the less experienced surgeon or oncologist is trying to handle an awful lot outside of kidney cancer per se. And for the most part, we'll be very grateful to have you understand his concerns for you and how you might work together to get the best resources and the best treatments options laid out to you. And that's a lot of our discussions. So with that, I'll let you ask probably the same to Salima.
Yeah, similar. What topics or themes come up a lot, Salima? I'm sure that you, while the people might, kind of come in and out, depending on their, caregiving experiences and things like that, I'm sure that there are a lot of the same th topics or themes, but what do you hear a lot from the caregiver participants and caregiver connections?
Amy, thank you for that question. 7 years ago when I was diagnosed and I joined the KCA, we didn't have anything like this. And it's just so wonderful to see this evolve now that we have patient perspectives with Peggy and we have this for the caregivers. They both offer a little nuanced differences, right? One's more patient-based and one's more caregiver-based. But, we always start the group with no shoulds, no coulds, no have tos. You don't have to talk. There's nothing that you need to do. You can sit, you can be a voyeur, you can watch, you can listen. We talk about all things kidney cancer. Sometimes it's people just having a hard day, surrounded by, appointments or whatever. Sometimes it's the diagnosis that they just got. Sometimes it's just they're exhausted with, the care. Sometimes we just have a safe format for them to listen, for them to talk. And that's what it comes down to be able to share our experiences together, to know that we're not alone, to know that there's other people that genuinely love and care about them. We have a core group of people that come every single month, and then we have some newbies that come, flow, ebb and flow type of thing. It's just a wonderful thing. I'm just so proud to be a part of it. It's, I think, just one of the things that's just been so wonderful to have. When I first got diagnosed, I didn't have that, capability of speaking to other people that much. It wasn't so out there like it is now. We have all these wonderful groups with the KCA, like, Sid was just talking about the Facebook and Anna talking about the podcast. And we have these two. It's wonderful. I wish one day that we can do it in person because I would love to be able to give every single one of them hugs every time we meet and share. But it's just honestly, we open and shut with anything and everything that is on your mind that deals with kidney cancer in a caregiver space and also in a patient space. Sometimes we've even had people that just, they don't even want to say anything at all. They just want to sit and experience being with somebody. So we offer that for them as well.
Yeah, it's nice to, even if someone doesn't speak, to give them a dedicated hour to to themselves to recharge perhaps as a caregiver, but to also learn from their peers. That's a gift to a lot of caregivers when it's a very hectic, busy, emotional time. So that's a great space to create. All right, my final question for both of you, and either one can answer first. What's been the most meaningful or rewarding opportunity that you've found while you've been leading your respected support group?
Well, I'll go forward just to think about. Here's kind of going back to myself when I was first diagnosed and found the few people, thanks to a KCA program, day program or morning program, that none of us in that group of patients understood the main speaker. We were polite and listened. And after this wonderful woman left, somebody braver than I turned around and said, who understood any of that? And that for me was the motivating push. I'm an ex-school teacher. I was interested in language, and I thought, I bet I can be helpful. And to have people have patient-friendly information, to have access to care through Zoom meetings like this, that was biggest change, the most important thing. And it's been incredibly meaningful to me as a patient to see people who the group, not just me by any means, but the group would say, oh, you need to talk about perhaps a better diet or managing your side effects better. And then to be able to say, and perhaps your pharma will be able to help you understand how to manage this with you and your doctor, who might be new to both the medication and the disease. So it's this tremendous collaboration that has developed, really going after the needs of the patient, which were frankly not addressed well 20 years ago because it was just too difficult. And of course, to see the tremendous improvement in treatments and to find people who say, oh, I've been well and alive and doing well for 12 years. Well, 12 years ago was a nightmarish time in kidney cancer. So that, and frankly, daily, when I do some of my writing and sending articles to help people, it's really satisfying. And the one way that I've been able to say thank you to researchers and doctors and other patients who dragged me out of the mud early on.
And Salima, what about you?
That's a really great question, Amy. I think, what do I find most rewarding? It comes with responsibility hosting because I feel that probably the most rewarding thing for me personally would be seeing people open up and find a real relief that I was able to accommodate that, whether it's like laughing, crying, tearing up, and they don't feel so alone anymore just from coming. And to say in that moment that the caregiver or the patient, they're not carrying it all alone anymore. That's it. That's why I come every month, because I know that feeling, and to just help one person not feel that way, it makes it all worthwhile. That would be the most rewarding thing for me.
Thank you both. You each provide a very unique perspective of the emotional support needed for a kidney cancer patient and caregiver, and so we really appreciate your efforts each month in leading our support groups. So we are very much appreciative of your efforts. All right, so I'm gonna have all of our participants turn your cameras on, and you can unmute yourself. So we're going to have a few minutes for questions and answers. So if you have been listening to our conversation today and you're like, I want to ask a question, but I don't know if I want to, please ask your questions. Now is the time. We have one in the chat, and I'm going to open this up. So it's a little bit of a loaded question, but for all of our kidney cancer patients, I'm sure that you can definitely give some insight into this. So one question that was asked was about dealing with the weight of emotions and feelings after a kidney cancer diagnosis, losing joy and things that you found that you used to love to do every day or with a lot of regularity, also talking about anxiety, something that a lot of people struggle with. So I'll open it up to any of our patients on the chat or on the webinar. How do you deal with these feelings? Do our support groups are a great option, are listening to our podcast so you don't feel alone, the Facebook community, but any other insights into how to try to find joy again after a diagnosis?
I can tell you it wasn't easy as a parent. My first thought and ongoing is that somehow I have poisoned my children with my background and getting kidney cancer, which couldn't be attributed to, at that point, much of anything except bad luck. And the goal for me at that point was to show them I would fight my way through this as best I could, but feeling that I had done something bad to my children. It's going to be bad enough that I was going to die and leave them, in effect, young adult orphans. But to think that I had poisoned them with my genetics or something I was doing was wrong. And I hear that, especially, I see Sid nodding, got young children or parents who rely upon you. You feel guilty and betrayed very often. Mm-hmm. So that's why I had to learn a lot, because that grounded me.
Yeah, I think, the first couple of months I think it would be unrealistic for me or anyone else to be like, yeah, like just kind of get through it. It'll be okay. I think accepting that those first couple of months are a little rough. I don't think I've talked to a cancer patient that hasn't said the first couple of months, either during or post treatment or, whatever road that you go down after your diagnosis is easy. I think realizing that those couple of months are kind of a surreal feeling. I remember kind of just thinking that my days really sped up fast and then also slowed down at the same time. Like it felt like uh, I was using too much time to think about my diagnosis, but then all of a sudden it would be like the week after, and it would just be kind of a surreal feeling. But I think the thing that helped me the most was connecting with other patients, specifically other like young adult patients that were in my shoes. So trying to find people that have kind of not only walked in your shoes with the same diagnosis, but also maybe have the same type of things going on in life. Doesn't have to be exactly the same. I wouldn't say any, I would say, then, it doesn't have to match, one for one there, but that really helped in the a couple of months after my diagnosis, for sure. But I don't think it would be realistic to just say, hey, like it's going to be tough. It'll be okay. Like it really is. It's a tough situation, and connecting with other patients or other organizations in the space, I think is very helpful.
I'm going to piggyback on you, Sid, as well. I think acceptance is a key. You come to a point where you're in your head all the time. It's very, very difficult. Your whole life has changed. But one thing that I didn't give myself much looking back was grace. Give yourself some grace. The emotions are difficult. You're in your head a lot. You are having thoughts you've never experienced before. And all these things are difficult. So allow that space and to be forgiving and graceful to yourself that it's a difficult time. Reach out when you're in your mind. The best thing to do is what? Get moving, go talk, go do something. Spend some time in it, of course. You have to grieve and go through the emotions. But some of the most important things are to be, aware that you're going through that and to,
Mhm.
yeah, you close the book on it. You realize you just spent 2 hours like freaking out. Okay, that's enough. I'm going to go spend time with my children. I'm going to go for a walk. I'm going to do these things. Acknowledge that and acknowledge, give yourself a hug and give yourself some grace and acceptance. It's a difficult time.
Mm.
One question. Oh, Anna Maria, did you want to add to
I
that?
just wanted to add really quickly to the end of that is to remember that it's not your fault. Our guest who's going to be who for the episode on sexual wellness made that point as well, and I think it's something that bears repeating because for me personally, that is the thing that even 5 years on, I still struggle with the most is recognizing that having cancer is not my fault and was not my fault, especially having two. I think for a lot of people who have multiple or multiple recurrences, it's so easy to kind of go into that spiral of like, well, what am I doing wrong? What did I do? Did I eat the wrong thing? Am I exercising too much? Am I doing this? Am I doing that? It's not your fault. Cancer is not your fault. Sugar doesn't cause cancer. Sunlight, I mean, it may, but like, you know what I'm saying? Like there are these things that they say, like essential oils, seed oils, like they don't like these things that you're eating, ingesting, doing, do not necessarily don't cause cancer. Like it's something that ends up happening to you without sometimes without reason. And so it's important for you to just remember it is not your fault. And that's all I wanted to add.
I add, I was advised by a dear friend that my kidney cancer was caused because I was so very pissed off at somebody.
Mm.
But
Wow.
then I thought, I am surely not going to go to her and ask her how I managed to get breast cancer.
Yeah.
I didn't want her theory on that.
Uh-huh. Yep.
But you
Wow.
carry it as what did I do? What where where did I go wrong? What's sin? And people have said, well, you probably have sinned. I thought, great. Yes, I certainly have sinned, but I don't think it turned into a 10 centimeters tumor.
Yeah. Mm.
Lots
You
of comments. We hear that a lot from patients, lots of comments like that. And probably not the most helpful of comments. No, not at all. Jackie, I have a question for you. And I don't know if there is an answer to this, but is there a typical like type of mentor connection, between mentor and mentee? And like, what does that look like? Or is every relationship, mentor pairing unique? What can people expect?
Yeah, thank you for that question. It is where we try to match you for what you need. So a lot of times people say like, I just have one or two questions, and it's about not even something that is about the diagnosis. It could be outside of that, but is impacted by the diagnosis. So example, is about family planning. What does family building look like after cancer? And you can talk to other people that have done different methods, IVF, fertility, options, surrogacy, adoption, all of the things. And while sure, the cancer diagnosis is what has led you to this situation, but you can talk to different people about it. So that's an example that we know that you're more than your cancer diagnosis, and that has brought you here. But you have the opportunity to connect on multiple levels, and with the caregiver elements too. A lot of times people ask about that. They're like, "Oh, you don't want to talk to me because my loved one has passed away." Well, that's not necessarily true, because we also help the caregivers through the entire journey, whether your loved one has just been diagnosed or if their loved one has passed, because it's all part of it. And we want to make sure you have somebody that understands what you're going through. So every single match is individualized and personalized and meets you where you are at.
All right, and I have one final question. Sarah, I don't know if you have any, but I have one final question for Rosemary. You talk to so many different patients and caregivers and just people reaching out for different support and needs. What is one thing you wish that people who reach out to you knew, whether it's about their diagnosis or about resources? Like, what's one piece of advice that you would want to give to anyone who wants to reach out or who has reached out?
That's a really good question. I would say overall that for people to know they don't have to go through it alone, that there are resources out there. Um, Individuals that I get to work with, I'm lucky they found us. I'm lucky that we get to have a conversation. I'm lucky that we get to share resources, whether they're internal through our organization or through other organizations. Happy to be part of that team. So I just really think it's important that people surround themselves and with help, supportive people. So yeah, I hate to see anybody go through it alone.
Before I have Sarah wrap us up, any final thoughts from our speakers today about any of these resources or anything else you want to share? Final thoughts.
Just quickly that we had an episode on fertility last season. Since Jackie had brought that up, I figured I'd plug that. We had it with an expert from Northwestern, and this season we should have this or season 6. We will have an episode with a patient themselves who went through pregnancy after a cancer diagnosis. So just wanted to let you know that.
Very helpful.
I'd like to add that you have a perfect right as a patient, caregiver, whomever, to speak to your government officials, whether it's the people at the social services department or the senators in this country, to talk about the tremendous challenge and impact and devastation that kidney cancer and other cancers give to us, and the support for those kind of programs and the support for funding for research is critical. 20 years ago, or 21, when I was diagnosed, there was one medication, and not many people benefited from it. I am so incredibly lucky. And That's no way to run a health system, is just say, well, be lucky. We need research. It's very effective. It's changed lives already and will only change more if we can continue to do, and then to share those resources as the KCA has done, patient to patient, researchers to patient, is an effective way to help people who desperately need it. So you have a role to play, even if it's not not something. You've got gifts to give to the kidney cancer research and other cancer researchers, and your time and efforts will be appreciated.
I want to share that as well, that 7 years ago, when I volunteered and started joining the KCA, to watch it grow into what it is today, I can't even imagine where we'll be at in 7 years from now. I'm super thankful to have this organization. I'm so happy that we have this for patients and caregivers alike. It's such a plethora of resources and knowledge for us, for patients, for everybody that's affected by kidney cancer. And I'm just very thankful that we have this organization, that we're able to be part of it, to share our stories and to help others be a part of it. And just very thankful for everything you guys offer. Very lucky to have the KCA.
Well, thank you guys. You can feel free to turn your camera off. We're just going to do some closing remarks, but thank you so much, everyone, for joining us. We really hope you learned more about the KCA. Just know we're here to support you every step of the way. Just a reminder that this will be posted on KCA's YouTube channel in the next few days, so just be on the lookout for that. The best way to access all the wonderful resources that our speakers talked about is by visiting our website, kidneycancer.org, where you'll find everything we discussed and more that we didn't get a chance to discuss today, such as our care packs, which we have two options of, one for patients and one for caregivers. So just make sure to visit our website. Again, thank you for tuning in today. Thank you for being part of our community, and just have a wonderful rest of your day.
Thanks, everyone.